Hello my fellow teammates and all the audience that I appreciate who will watch this presentation. On this blissful occasion, we from the small group discussion B3 group would like to present our student project entitled Clinicopathological Aspect of Bleeding and Clotting Time. But before moving forward to the next plan, let me introduce all members of this group which is shown in the slide. Next. We will present our student project with three main chapters which are Introduction, Literature Review, and Conclusion. For the first speaker, time is yours.
Okay, my name is Sara Putri Bungaran with 078 as the last three digits of my student number, and this time I'm going to explain about the background of the student project. Bleeding time remains necessary and has historically been considered the best to determine vital function and blood vessel integrity. Although most laboratories and hospitals no longer use this test, bleeding time is still used for physical preference rather than clinical research. Not only bleeding time, clotting time is also necessary in measuring coagulation ability when more sophisticated equipment is not available. We need to know the methods to perform bleeding time and clotting time so that as future health workers we can apply them correctly. The author also explains some clotting disorder to provide real insight related to bleeding time and clotting time. In addition to enriching the report's high of knowledge, some of the statements mentioned above are the reason why this literature review was made. That's all for me. Thanks for attention.
My name is Putu Sri Dianingsih and my three last digit of my student ID is 070 and I will continue the presentation. So the proper formulation of our student projects are first, what are the definition of bleeding time and clotting time. The second one is what are the methods that were used to measure bleeding time and clotting time. And the last one is what are the example of blood clotting disorder. The next one is objectives. So the first one is to give information about bleeding time and clotting time. The second one is to explain the method that were used to measure bleeding time and clotting time. And the last one is to inform about the examples of blood clotting disorder. Now, the next one is benefits. So, we sincerely hope that this literature will give a great insight about bleeding and clotting time in the clinicopathological aspect in order to enhance the knowledge of society and healthcare association regarding this matter.
Okay, thank you for your time. And now I'm going to give a brief explanation about bleeding time. So in a nutshell, bleeding time is widely considered one of the best tests used to determine platelet function, blood vessel integrity, and the time it takes for patients to stop bleeding. But over time, with the development of platelet function monitors, bleeding time tests are decreasing in popularity, since performing it has several risks such as scarring and poor reductibility. That's all for me. I'll let my partner continue.
Okay, thank you for the time. I am Wayan with three last digit numbers, 86, and I will deliver the chapter 2.2, Clotting Time. Clotting time is included in a blood test that is carried out routinely to determine the status of coagulation possessed by patient in clinical practice, which can be estimate extrinsic or general coagulation pathway so that they can detect if there is a deficiency of fibrinogen concentration in it or lack of several factors including factor 2, 5, 7, and 10. To the next speaker, the floor is yours.
Now, I'm going to explain about bleeding time test. There are two basic techniques for determining bleeding time, which are routinely employed and is classified according to the size and location of the incisions. Infection and bleeding concern exists with both approaches. Each approach has a different normal range, thus affecting the clinician's interpretation of the data. The normal range for the IV method is 2 until 7 minutes, and for the Duke method is 2 until 5 minutes. IV method is the most commonly used as the bleeding time test, as it is the most accurate, although it has a higher scarring potential. The Duke method is not advised and cannot be standardized because of its potential to result in a significant local hematome. Next will be explained by my colleague.
Thank you for the time. My name is Joanna with the last three digits of my student number is 079. This time I'm going to explain some of the methods that we use in blood clotting time tests. Now the first one is fibrinogen test. A fibrinogen test is a test that measures the level and the functionality of fibrinogen in the body. The second one is prothrombin time, or PT test, that assesses the function of proteins in the extrinsic pathway of the coagulation cascade. The INR, or International Normalized Ratio, is the result of the ratio of the patient's PT to the control PT. The third one is the partial thromboplastin time, or PTT test. It's a blood clotting test which assesses the function of proteins in an intrinsic pathway instead of the extrinsic pathway. That is all from me. The next one will be continued by my friend. Thank you.
Thank you for the time. My name is Yuda. Today I would like to explain about Lee and White method. Lee and White demonstrated a simple clinical method to determine the coagulation time of blood in 1913. The original purpose is to diagnose various hematological disorder and to monitor anticoagulant therapy. There is modified diagnosis tool of snake venom-induced coagulopathy and to monitor antivenom therapy efficacy. Differences with another test is it is must observe every following minute after 5 minutes undisturbed. That's all from me. For the next speakers, the time is yours.
Okay, my name is Putu Sri Dianingsih with the last 3-digit name 071. So here I will continue to explain about the another clotting time method. The fifth is capillary tube method. Capillary tube method is a method for assessing blood clotting time, which value are significantly variable according to different standard procedure. The coagulation process is especially non-uniform due to the impact of gravity. The procedure are letting capillary blood to fill the tube, wait until 2 minutes, break the capillary tube and separate it slowly, and then repeat for every 60 until it forms a cone. And then the sixth is complete blood count, which provides details on the synthesis of blood cells, including white blood cell, red blood cells, and platelet. Platelet operate as a coagulation factor attachment site, which increase the effectiveness of a coagulation response. There are 3 procedures. First is manual blood count, which counting blood in Thomas lights, and an impedance method using electrode to count the blood, and flow cytometry method, which using the light scattering to identify blood cell. Okay, the next presentation will continue with my colleague. Thank you.
Hello everyone, my name is Ariawan with 073 as the last 3 digits of my student number. This time I will explain about the von Willebrand disease and thrombocytopenia. Von Willebrand disease is a disorder when the blood doesn't clot properly due to the lack of von Willebrand factor. There are 3 types of von Willebrand disease, such as type 1, 2, and 3. Tests that are needed to diagnose, such as von Willebrand factor antigen test, CBC, and so on. Thrombocytopenia refers to a condition in which the platelet count falls below normal and can be mild, moderate, and severe. TP can be caused by autoimmune, drugs, and even infections. Tests that are needed to diagnose is CBC, blood smear, and so on. That is all from me. The next part will be explained by my colleague. Thank you.
Hello everyone, my name is Sara and Natasha Putri with last digits of my student number S083. I will explain about thrombophilia and Bernard-Salles syndrome as blood clotting disorders. Thrombophilia is a disorder in which blood clotting happens often. There are several types of thrombophilia. The first one is factor V latent, which makes prothrombin levels in plasma rise. The second one is protein C deficiency, which reduces the activity of protein C, making inability to control coagulation, thus resulting thrombophilia. The third one is protein S deficiency, leading to thrombophilia and venous thromboembolism. While in BSS, there are large platelets, mild thrombocytopenia, and platelet dysfunction, consequently insufficient ability to form clots. That's all from me. The next material will be brought by my friend. Thank you.
Okay, my name is Partha. The last 3 digits of name is 080. Okay, let me explain about hemophilia. Hemophilia is a condition that makes the blood difficult to clotting. And then the second one is deep vein thrombosis or DVT. DVT is a medical condition that occurs when a blood clotting or thrombosis form in the deep vein, usually in lower extremities. That's all from me. The next will be explained by my friends. Thank you.
Hello everyone, my name is Gabriella Ferenina with 081 as the last 3 digits of my student number. Now I want to present about conclusion and advice. Conclusion, breathing time remains necessary as historically been considered the best test to determine platelet function and blood vessel integrity. There are 2 basic techniques of determining breathing time, IV methods and drug methods. Clotting time is included in blood test that is carried out routinely to determine the status of coagulation possessed by the patient. In clinical practice, there are many methods of test clotting time. The common ones are fibrinogen test, PT-INR, partial thromboplastin time, Lee and White method, slide method, capillary tube method, and complete blood count. Blood clotting disorders may be inherited or acquired, such as hemophilia, thrombophilia, von Willebrand disease, thrombocytopenia, Bernard-Salles syndrome, and deep vein thrombosis. Advice: breathing and clotting time are important to make human beings survive. Besides that, as future healthcare workers, we need to know how to measure bleeding time and clotting time to ensure diagnosis of patient in need. General public also needs to know that blood clotting disorders not only come from genes or inherited, but also can be acquired. Given there are many factors that may slow down clotting time, eating food and supplements that contain high vitamin K will boost the time of blood clotting. That's all from me. Thank you.
That's all from our presentation about our student project. We would like to apologize if there are any mistakes we made during the presentation. And thank you for your attention.